How over the time of doing your home care company, and even I guess in your time dealing with your grandmother, how have you seen dementia care evolve or change?
Well, I think not as much as at least I would like to hope. I think at least if nothing else, with social media, with the work you're doing, the work I'm doing, and, countless others, I think there's a lot more attention being focused and turned to it. Where in the past, even going back to the passage here in the States of the Medicare Act, people were considered senile, right? It was senility. It wasn't even really a medical diagnosis. It was more like a social, psychological diagnosis. So healthcare didn't really want to get involved with that too much. And I feel like that's part of, and I know our good friend and Pete Hill at the D Word, and I think that's such a great name for his show because it's very true in my opinion. Back then, they didn't want to say the C word of cancer because, there were so few options and treatments available and prognoses were so grim. Doctors are here to heal and to treat and to make things better. And when they can't, that's a sign of their own, failings, they feel like, right? And so now it's the D word. How many times I've talked to families, or maybe yourself included, where a family has to go 3, 4, 5, even more to get an actual diagnosis of dementia because, and I don't want to speak for doctors, obviously, but, I've heard it enough where it feels like they're afraid to give that diagnosis because they know what that diagnosis will mean. So it's almost like if we don't diagnose this, maybe it's not real kind of thing. So I feel like the change though is I think society, a little more than healthcare, has really, sounded the alarm on trying to raise that awareness. I mean, you have, great work you're doing and all these other great, creators, inventors, and companies where families are having to get the resources and information from everywhere, but where I feel like they should be getting it from, and that's from their physician and their healthcare team.
If we had to look at an American lens, what supports exist for all Americans if they come or if they have a dementia diagnosis?
Support in the terms from a healthcare standpoint or society?
From a healthcare standpoint. So in Canada, you get a certain amount of hours of support from a home care company, whether it's a government funded one or whether it's a private one. The company will go back and back charge the government. So there is those kind of supports at a certain level. Obviously, it can't cover 24/7 support and stuff, but those exist. And then there's support programs through, let's say, the Alzheimer's Society that can come alongside and kind of fill in the gap, or you have companies like mine that come alongside and support the caregiver. So I'm curious what it looks like in the American lens.
So if you have a loved one and they need to go into memory care because it's not financially viable to keep them in the home for the care, or it's not practical for any reason, you put them in the memory care. Memory care is going to be paid for out of pocket. You really, you can go into a nursing home, but then you have to be in the hospital for 3 days for Medicare to cover it. But that's only going to cover it for a certain amount of time. Then they're going to come to you and talk about enrolling you into Medicaid. Medicaid, again, I won't get into much because it is a state by state, basis. I can just speak for Michigan. So there's really, you have a wonderful thing. I have some Canadian friends and, they talk about how you guys do get that quote unquote free home care. Obviously not the 24/7 like you mentioned, but that's still something rather than nothing. Now there are waivers, at, your area agency on aging that if you qualify, you might get, a couple of hours of some respite, but again, that's also limited. And, there's a lot of roadblocks and obstacles to that kind of resource. Alzheimer's Association, 24-hour tip helpline where you can call and speak to somebody. There are caregiver support groups, virtual or in person. But as far as real tangible help, it's just not there, and there's options somewhat for your loved one. But like I said, some of those are going to be just, still cash out of pocket.